Spay is an important procedure that benefits the health of your pet. We know that bringing your fur baby in for any major procedure is worrisome. In this video, we'll show you what happens during a spay procedure so that you can feel as confident as we do caring for your companion. The first step in preparing for surgery is catheter placement by one of our skilled and capable technicians. They will administer an IV injectable anesthetic to make our patient feel sleepy. Once she is asleep, they will intubate her in order to administer gas anesthesia and maintain her sleep state for the duration of the procedure. Under anesthesia, our patients are safe from feeling any pain, fear, or anxiety during surgery. While she is conveniently asleep, our patient will also receive a mani-pedi. Lubricant is placed on her eyes to keep her eyes from drying out during the procedure. One of our highly trained technicians will monitor our patient's vital signs throughout the procedure. She will make sure that heart rate, breathing, and blood pressure do not show notable changes. She will also check vitals on the patient's body from time to time. Computers and machinery are excellent tools, but there is no substitute for an expertly qualified human monitor. Spays tend to be time-consuming because they are a more invasive procedure and it takes time to navigate the internal organs and find the uterine horns.
Double ligate to make sure that all blood vessels are adequately closed. So it's a bifurcated uterus, so it means there's two horns, unlike humans. And so we have the ovary at the end on each side, and that's the part that we ligate what's called the ovarian pedicle. And then we break down kind of the connective tissue leading to the bifurcation of the uterus. And then we ligate the uterus itself, and that's the surgery.
A spay is an elective procedure, and some pet owners may wonder why it is important to have the procedure done at all. Our first answer to this question is that it is simply the right thing to do. Spaying your pet is the responsible choice to help control the pet population. Moreover, animals who go without being spayed are at a high risk of suffering severe medical consequences. Intact females are at a highly increased risk of mammary cancer, the result of which is a major surgery to remove the entire mammary chain. They are also at an increased risk of uterine and ovarian cancers.
So this is the uterus, but the ovaries are right here and here, and then this is the bifurcation. You can kind of see that split at the end there. So we'll ligate that part. And this kind of white thing is the cervix, so that's kind of where we want to ligate. Just so I make sure that I get the tightest ligature possible. They do have fluid that oozes a little bit, and a lot of times puppies have a little bit of fluid just in general in their abdomen. But I just want to make sure there's no active bleeding. So I'm just double checking that the uterus or the ovarian tissue is intact. Because there is a possibility that if you accidentally cut the tissue too short, that you can leave a piece of the ovary behind, and then the pet will go back into heat.
When the procedure is complete, the patient is taken off the supply of gas anesthesia so that she can wake up naturally. The endotracheal tube will remain in place until a technician verifies that she is awake enough to swallow and breathe normally. Microchipping can be done at any time. However, the microchip syringe is thicker than other types of syringes and may cause mild discomfort, so it is ideal for our patient to have this done when she won't feel it. One of our nurses simply injects a tiny microchip under the patient's skin. Immediately following her procedure, she will be taken to the therapy room to receive post-operative laser treatment on and around her incision area. This reduces pain and swelling and promotes healthy healing in the tissue around her incision site. Finally, she will be placed in a kennel in the treatment area. Our spay patients typically stay with us for the remainder of the day so that we can closely monitor them during their recovery. That way, they are well rested and ready to go home.